Yeah, that's good. That's a good thing. Gloria? Hey, good to meet you. Oh, okay. So you are.
All right. Sorry, everybody. We're going to get the meeting going. Thank you, everyone. Thank you, everybody. It's 2 o'clock. We're going to call the meeting to order. This is the May 28, 2026 Larimer Regional Opioid Abatement Council, Region 2. It's our main meeting. Let's call the meeting to order and do a roll call of voting members to see if we have a quorum. First, I'm going to call for the town of Estes Park.
Yes.
Great. Welcome, Mayor. The city of Loveland.
Here.
Thank you, Zeke. And that's you on owner. We couldn't tell who you are with this owner on your Zoom.
Yeah, let me see here. It says Zoom is unable to connect to my camera, but yes, that's me. I'm talking right now if it says
Okay,
owner.
great. Welcome, Zeke. City of Fort Collins. Nobody. I'm not making Rupert on our way. Do we have the town of Wellington?
Here.
Hi, Mayor Pro Tem Mason, welcome. Larimer County.
Here, Larimer County Commissioner Jerry Shackley down.
Wonderful. I just see Rupa, so City of Fort Collins. Rupa is here, and representing the Larimer County Board of Health is myself, Tom Gonzalez, Public Health Director. We have a full quorum here. All members are here. So first action here is public comment. Is there anybody that would like to make a comment to the council? Seeing none, hearing none, we will close public comment. We'll go to item 3, which is approval of the April 23rd, 2026 meeting minutes.
Mr. Chair, I move that we approve the minutes as presented in the agenda.
I have a motion. Is there a second?
I will second.
We have a motion and second. Any conversation? Hearing none. Does anybody oppose that motion or have concerns with the motion? Hearing none, that passes unanimously. Folks, we have quite a few items on grant administration to get through in an hour and a half here. So we're going to move right along. You'll see the agenda was updated yesterday. Thank you to Heather and Janelle for their swift action yesterday, as well as our attorney, David Arrow, is helping us with the letter. But you all see in the packet, the updated packet, we included 4A, which is Harvest Farm Notice of Program Closure. We received the notice, unfortunate notice, of the closure late last week. That then initiated a letter that we're putting in front of the council, where that letter would go to Denver Rescue, doing business as Harvest Farm, and Fort Collins Rescue, which outlines provisions within their grant contracts, and then resubmit payment for capital investments that were done at Harvest Farm, as well as the most recent 6 months for the grant that was approved last month. That total comes to $516,384. So I will pause there and turn it over to Commissioner. Yes.
Thank you, Mr. Chair. It was quite shocking and surprising to have that. I want to remind everyone we had approved that capital expense and for a septic tank and the expansion. That was really cutting edge for any ROAC. The state, in ROAC, was really uncomfortable with doing things like that. And so they looked to us to start some kind of policy or information regarding capital improvements. A lot of ROACs had some trepidation with that. And we wanted to forge ahead because we felt like that would help increase some capacity And subsequent, we came up with a capital policy that was now written in some of the extensions. One thing that I think I would like to add to this, I know it's not, I have consulted the county attorney that is serving as attorney for WAC, is that in response to this and also to response to the 3 extensions with the contracts and others, there's a lot of staff time and capacity and time for attorneys to read all these. And I know it's not in our agreements, but I do think we need to ask for some reimbursement administration services because as I understand, Mr. Chair, your staff had worked overtime and had to drop a lot of things to respond to this. And we had the attorney to have to go and draft a letter. And that is administrative service money and time out of our ROAC funds. And so for something that is something we reacted to. So even though it's not currently in the grant agreements, I think we should ask for that. I don't think it's a large amount of money, but I still think we should add it to that. And also, I think we should consider next meeting whether we need to also ask for administrative expenses back because these grants take a lot of time, and with the 3 extensions and the scrambling we've had to do the last week, I think it warrants to have to reimburse those staff time and capacity because that comes out of the ROAC money, and we know that's a finite fund. So I would like for us to add that, with the understanding that's not in. It may not be, it might be denied, but I think we need to ask for it. And I'm not sure if you had gotten some numbers or ideas of how much that might be for the, and I don't know if county attorneys on there, but I do think that's something we should consider. And I'm grateful for David writing this letter so quickly and getting this forward and staff reacting. I mean, you guys all put in overtime and put extra stuff in, and I really appreciate the diligence and the hard work by all.
Well, thank you for that. Yeah, I do appreciate David, Janelle, and Heather dropping everything. They did swiftly move on this. They're impeccable professionals, so I appreciate that. Any other comments on this agenda item?
So can I just ask clarification? So Commissioner, you're asking for it in addition to the capital investment and the $160,384. So a total of $516,384 that we're asking back from Harvest Farm, an additional, like the administrative costs?
Yeah.
And is that like at 10% or what is that dollar amount?
We would have to look at the hours, time spent into that. We have not had the time.
We haven't had time to do that. So, and I don't know if we can add a sentence in there that we also would like to see administrative expenses in response to writings that are in responding. So I feel like that's important. I mean, it's costing us money out of the account to have staff do this extra work. And like I said, there was 3 extensions on that capital group. We just cut the ribbon on that building in February. So.
I'll just say I don't feel strongly that we need to include that, but I'm open if others are also.
Well, I feel strongly, Mr. Chair, because it is county staff and it's taking away from, we're already stretched thin with all of our things and we don't have, this is, we're paying county staff back and it's taking away from other duties as assigned this week and last week. And with the 3 extensions, it took extra time to get those written and I still think I don't think it would be more than $10,000. I think it'd be under that for sure. It's not a lot, but I do think and I do think we should look at it into the contracts going forward, that if there's something like this happen again, we're gonna probably ask for a little bit of response. I just think that's, we're one of the few ROACs that the county is kind of doing it. Others paying consultants and have facilitators, they pay extra and that would be probably part of their thing, but this is taking away and we're taking funds out of the ROAC to pay for that, so.
All those online, Brian and Zach, just making sure you're feeling connected here. Do you have anything to provide or comments?
I don't have anything to add. I agree with the commissioner's comments. I do think we should pursue those administrative costs as far as that goes. So.
Okay. Think, do you have anything else to add?
I don't have anything to add.
Okay. David, question for you. I saw you were on. Is that something that's allowable to ask for those costs? And how would be the mechanism be for to ask for reimbursement on the administrative costs?
The the letter can be amended to include a request that those costs be repaid. There's not a provision in the grant agreement that addresses that, and so there is no enforcement mechanism for it. So I mean, obviously, almost anything can be requested in a letter. The question would then be if it's denied, is there a mechanism to pursue that? And under the grant agreement, there is not. So this would basically be adding in a provision, just making the request, and seeing what the response is.
Wonderful, David. Thank you for the clarification. Mayor, do you have anything to offer or provide on this with your thoughts?
Only that with my relative newness to this, I'm probably going to defer in favor of the commissioner.
The one thing I'd like to add is, it's tough times. There's uncertainty with HR1. There's uncertainty with the raising costs. My understanding, Harvest Farm was by the letter running in the red and was going to continue to run in the red. They've been a wonderful neighbor. They've helped many, many Larimer County individuals on the road to recovery and being a healthy citizen. I don't want it to be perceived that this ROAC is penalizing them or there's some punitive piece to that. It would be minimal. I mean, it would be a few hours, whatever, but I'm more with Rupa. Whatever the council wants to do, but I would want it to come from my heart that it wasn't punitive, because we're all looking at our budgets, all going, oh no, all saying, how are we going to move things forward over the next 2 to 3 years? And I'm nervous this isn't going to be the last wonderful asset we have in our community that may be lost due to funding and costs. So there's a piece of that I worrisome, that I don't want it to be perceived that there was some retaliation.
And Mr. Chair, I'm not asking retaliation. I want the staff time capacity and even the lawyer's time it costs money, and it's taking money out of our funds, and it's not retaliatory. And I think it also, we're setting a precedent of how we move forward in case this does happen, which I hope it doesn't. I mean, this was something I've been worried about for a while now. And I don't think if it was substantial, I would be like, yeah, we should think about this, but it's very minimal. I think it's just the principle of understanding that there is administrative fees and costs to doing this. And we've had to move very quickly to write letters and look into this and figure this out. And that took probably a dozen hours at least with everyone invited. So I just feel like it's if it was, like I said, it was going to be a big chunk of it, but it's probably less than 0.5%. So I feel kind of it's important to make a precedent with that.
Thank you for that, Rupa.
Yeah, and I'll just say, since it's not already part of the grant agreement that we have, I mean, I would not want to ask for Harvest Farm for it, especially because in good faith, they did immediately reach out. They offered to say, hey, how do we repay this? Because we know we need to repay it. And so I do think moving forward, we can make sure that it's maybe included in the grant agreement, so it's pretty clear on that. And I don't know if we need to resolve this by moving to a vote.
And I do think that we can ask. We're not going to try to, there's no enforcement mechanism now, but I think we at least have to ask.
So yeah, we've got quite a bit of other items on the agenda we need to get to. So there's a letter in front of you all. There's a motion on the letter or a motion to amend the letter. We'll go for that process.
Mr. Chair, I would like to make a motion to amend the letter, approve the letter with an amendment with a statement drafted by our county attorney as sees fit, just requesting in a friendly, non-punitive way, the consideration of administrative fees, and you can maybe find out how much those are, in addition to this, because of the extra work that had to be in to to respond to this in the contract extensions. However, he felt that it would be appropriately, gently worded.
David, I see your hand. I do have a motion on the table following Parliament rules. Is there a second to this motion?
Yeah, I will second.
So we do have a motion and a second. David, for conversation.
My only question is, and I think I had asked this previously when it was being discussed, it looks like the 400,000 for capital improvement is listed in there, and the ROAX capital asset policy prorates it for each. It just says based on how long it's been used for that 5 years. So to the extent a motion is made and passed, I'll just add the clarification. We may need to amend the 400,000 to track that policy, but I think you're fine moving forward as proposed. I just wanted to let everyone know.
Thank you. So for clarification, the policy says prorated on the 400,000, which that went into effect beginning of March. So that would be March, April, and 21 days in May. That would be prorated.
Correct.
Okay. Thank you for that.
I'll add that to my friendly amendment.
All right. So to be clear, the motion on the table is the letter as is with two changes, or one addition and one change. The addition is adding administrative costs for this situation. And two, going back to the $400,000 and prorating it for about 2 months and 21 days. Mayor Pro Tem Mason, do you accept that?
Yes,
Changes.
yeah, I'll second.
Okay, any further conversation? Hearing none, let's take that to vote. All those in favor signal by aye.
Fine.
Aye.
Aye.
Is anybody opposed?
I had a question on mine from Jessica Hummer. Are they providing services through 6:30, so prorated through 6:30?
They're providing services to 6:20 is my understanding. Thank you for that clarification or question, Jessica. So yeah, they would be prorated till when it's not being used for the purpose of, yeah. So we had one, all in favor, one no. That passes 5-1, if I'm doing my math right. Okay.
Mr. Chair, when this all gets really changed, can that letter be sent back to the ROAX and we see the final version?
The question is, can the letter be sent back to the ROAC for the final version? Are you just saying for awareness?
For awareness, not to be
Yes.
provoked, but it can be sent out, but just so you can see the final version.
Yep.
Thank you, sir.
Okay, moving on, we got a couple items here that are funding proposals. We're bringing back Abundance Foundation. It's a follow-up from last month. There were some questions there. They submitted those questions in a packet. I'll have them come on up.
All right, seems like a lot on the agenda, so I'll be quick. This was a follow-up on the Larimer County residents from last month. Some of the data on that was what our program reaches. You can see here, 77% of our total program are Larimer County residents, so it's based on their zip codes in our program. Women's housing in 2025, 85% were Larimer County locals, that's 46 out of 54. And 100% of the ROC funding is dedicated to Larimer County residents, and we show that on our reporting. When it comes to the opiate specific, 64% that are in housing have identified opiates as in their top 2 drugs of choice. The outcomes is 51% are fully self-sufficient. Residents coming from housing where opiates are in the top 2 are already sober, self-employed, or it's not self-employed, employed and living independently. And then that goes up to 88% of the ones that are compared to, they're just waiting on permanent housing, but are sober and fully employed. So I believe that was what was covered or needed to be covered from the last round.
Any questions? Yes.
Thank you for bringing that information back. I appreciate that. I'm curious, when you say the zip codes that they provide, Is that an address or just a zip code? I mean,
It's their address.
Their address.
Yeah. So their permanent housing on their identification card is the
Okay.
zip code of Larimer County.
And then can you go back and clarify from your presentation from before, when you said you had a direct communication and working with the Department of Corrections?
Sure.
That's the state and a private company, and is that where you're getting these, is direct from the Department of Corrections?
So in the course of all of our sober living in the last 4 years, we've had 6 women come from the Department of Corrections, 5 of which have Larimer County zip codes. So we do get people from Department of Corrections as a referral source.
Yes, but your presentation was kind of highlighting that you were working directly with the Department of Corrections. We also have a lot of folks in community corrections and the county jail who also could use these services.
We do both.
But I don't know if that was clear in your presentation. That's why I'm asking for you to clarify that, because it sounded like you were, I think you even said a direct pipeline or direct link.
With both Department of Corrections and with Larimer County Community Corrections, Concord.
You'd also alternatives and.
Right. So that's where we get the majority of our clients right now is coming from the relationship with the halfway house in Larimer County.
And I don't know if that was clear in your presentation, and that's why I asked that, because it sounded like it was from.
So to clarify,
Corrections.
now that's where the majority are coming.
Yeah, and that's what I wanted to clarify, because it sounded previously that it was just Department of Corrections. And so you were taking clients from them because I know they need space, and that would be, for me, that would have been not really serving the residents, so, yeah.
Yes.
Okay. I just want to make sure that's clarified. Thank you.
Thank you. Any other clarifying questions here for Brian? Okay, seeing none there. We do have an action item here, which is the proposal for the second year of funding for Abundance Foundation for $211,550. How would the council like to proceed?
I would move to grant the $211,550.
We've got a motion to support the proposal. Is there a second?
Second.
There's a motion and a second. Any further conversation? Just making sure I'm not missing anybody online. All right, we'll go to vote. Does anybody oppose this motion? Hearing none, it passes unanimously. Thank you for your service to the community, what you're doing. Appreciate it. All right, moving along here. We have a proposal from the Larimer County Sheriff's Office.
Good afternoon. I'll just take a few minutes to introduce myself. My name is Marla Tatanzik. I'm one of the lieutenants with the Larimer County Sheriff's Office. As of January 26th, I was assigned to a different unit, and one of those units is co-responder program that falls under me. So I am relatively new. And then with this proposal, I have asked Sierra to do most of the work for us. So I will turn over to Sierra and she'll do the presentation.
I'm Sierra Method. I'm Larimer County Sheriff's Office Senior Grant Project Specialist. So I've been working with the co-responder team to kind of put this proposal together. Appreciate the time that you guys are allowing us to put in our request. And I know we're short on time, so I'll try and move through this relatively quickly. So we're requesting a little over $260,000 for embedding 2 licensed clinicians into our existing co-responder unit. Emphasis here on opioid substance use and the behavioral health. As you may know, we currently do not have any clinicians working with our deputies, so the emphasis here is on building that clinician capacity. And this is going to be a recurrent theme kind of throughout the next couple slides, but our emphasis is on kind of field-based substance use related use, assessments, interventions, looking at education around overdose risk, crisis stabilization in connection to treatment through referrals and other things. And then a main point here around diversion from jail and emergency departments. Next, please. So just kind of looking at the data and need for this, looking at county level data, we see high rates of fatal overdoses, ER visits, looking at some of the community-based substance use services throughout the county, and then within our own jail data, digging a little bit there, we see that there's a high rate of 1,900 individuals that are in withdrawal within our jail system when they arrive. So kind of this demand is here, and when we dig in deeper within our existing co-response data that we've collected over the last 2.5 years, high call volume, digging into, we've got about 10-11% is going to be hospital transports. A little higher rate diversion here, actually to Longview, with clinical diversion, and then our field bookings at a lower percent, but still not as low as we would like, obviously. This was kind of requested after the fact, but just honing in on this data and a breakdown over the last 2.5 years on an annual basis. Relatively stable. We've seen slight numbers in the drop in calls, but an increase in intake amounts. So we're getting a little bit more data from the people we're engaging with. Majority of the people we're engaging with are Larimer County residents, so that's 95%. We have a few other counties and as well as other states, but considering that we are on the I-25 corridor and other things, we would expect to see a couple people outside of that. I did a little data crunching on what we have. So the numbers with reported opioid use disorder and substance use is 1.5 and 38%. Little asterisk here on these numbers. All of this is based on self-reported data. So understanding that when engaging with law enforcement, there's probably or potentially a hesitancy to self-disclose some use of substances and other things. So we assume that this is largely underreported and undercounted. What we're asking for, so hopefully cut and dry, we're looking to add 2 clinicians to our team that would complement the 2 deputies and then the 1 sergeant that is currently our co-responder unit. And then we just want to make sure that they have the tools that they need and the training that they need. So that means onboarding, when they're called out to crisis situations, to make sure that they're being safe, that they have the phones, laptops, and then the reporting data. And then in talking with kind of colleagues, participation in the co-responder conference allows them to kind of build a network in the skill set, especially if they're new and they haven't been working with law enforcement or in a co-response emphasis. So what that means operationally, we're going to have immediate clinical support in these active crisis situations, in-field assessments and interventions, connections to these behavioral health and recovery sources, and then diversion. How we are tracking this kind of tracks along some of our objectives, but the percentage of calls that we have a clinician on hand, the percentage of these calls that are specific to substance use and opioid use and that intervention, making sure that it's documented. That's one area that I really want to strengthen within our current approach. And then these last 3 are kind of coinciding to diversion, right? So we're diverting away from hopefully reducing emergency jail bookings and moving that towards clinical diversion into behavioral health. My job is the accountability framework. So as the grants admin, I want to make sure that I'm appropriately reporting this data, making sure all of our decision making is based off of correct numbers and things, and then making sure that aligns with what things that funders would like to see. And this is my last slide, so I'll keep this one brief, but in terms of what we'd like to build upon, this is going to be a key one here. For Collins PD, my understanding is they have an existing relationship with UC Health. We've been in conversation with both, and so we'd like to replicate that model on a contract basis at Larimer County Sheriff's. So that's a working model that we'd like to duplicate. We do have existing deputies. They might not have a clinician, but they have the training and other tools necessary for this. So, we have that foundation of co-response, kind of demonstrated that need in the field. So ideally, once they're deployed, immediate impact. And at an agency level, we've made a hard shift, a strategic shift in the last 6 months to a year, where we're really focused on data-informed decision-making and this co-response with that. In terms of challenges, again, decreasing demand, that kind of parallels the high need engagement. Our mandate is unincorporated Colorado, so it takes time to drive to Red Feathers versus, maybe a block or 2 away. So there is that inherent barrier with the community that we serve. Patrol service expansion. So we've got essentially 3 deputies or staff dedicated to co-response. That means the majority of calls, substance use or mental health otherwise, is broader patrol. So how do we take the methodology that we have and in some ways disseminate it to the rest of patrol? And then this last piece is really a piece of me and an acknowledgement that I'm big on systems, so I just want to make sure that the documentation and reporting is there to coincide with all this work. So I know that was pretty quick and dirty, but happy to answer any questions or clarify.
Yes.
Thank you, Mr. Chair. As you know, I'm pretty familiar with what you're doing, and one of the reasons we pushed for this last time was there was not a clinician available after 5 o'clock. And especially on Friday night, there was not anybody to really respond. And so deputies were having to follow up on regular patrol deputies. They had a little bit of training, but they were having to respond by just calling people back. There's always these follow-up calls and take longer time at scene. And so it's not like they're spending more time with these calls and not the shorter as the data that I had shown before, and the 2% tracks with what they had shared with us before. So if you're going to add, so that's my first question is, will this increase the amount of time a clinician is available? Or is it just still the 8 to 5 or with the 2? What would be that was one thing they increased, was the goal was to increase the amount of calls they could take and the amount of time. So that's my first question.
And so we have run data on this, so where the calls are the highest volume, and that's what we would focus on. In our previous conversation with UC Health, the conversation is we need clinicians with both deputies, preferably, which is 7 days a week. Right now, both of those deputies work, it's kind of varies on the day, but usually anywhere from 9 a.m. to 6 p.m. is what they're on. Obviously, if our call need shows that a lot of calls happen after 6, then that's when we would adjust our call base to be on after hours to be available. So we do have data that we're collecting through as well, like, just when they happen. Right now, most of the calls, believe it or not, do happen like between 11 a.m. and 3 p.m. for whatever reason. But there's definitely calls after 5 o'clock, and we would make those adjustments with the clinicians to make sure that they're available, as well as the deputy schedules.
Okay. My next question, I'll let Mr. Sher. I'm very aware of systems, EMS systems, having been involved with that for almost 45 years now in EMS. And UC Health has also their inpatient and some of their ER visits for their behavioral health and things, and we have Longview. And there's lots of opportunities with other folks. So how would having UC Health embedded, they have their billing? Are you going to pay, is it going to be billed by hours? And will they be open to taking them anywhere, like Longview or the ER or to the UC Health behavioral health facilities? I mean, I'm just wondering how that looks.
Yeah, and the conversations I've had with Fort Collins Police Services, their corporals and their sergeant who are in charge of the corresponding unit, they have not run into any issues. They do plenty of transportations to Longview. It's up to the clinician to decide, and the deputy, in this case, the officer, decide what's best fit for the individual. And it's kind of a team aspect to it, a team attack, and that's how, I have not heard that they want to do it one way or the other. It's kind of deciding based on the need of the individual.
So having my ROAC hat on.
Yes.
Right? Not a commissioner hat, but a ROAC hat. So if these UC Health are not, they're UC Health employees, you're contracting, what is a long-term sustainability for keeping clinicians embedded? Because that is the cost. And I'm asking this question.
Absolutely. I would love to sit here and tell you that next year we're good to go. I don't have the answer to that. I do know in conversations with the undersheriff that co-responder is a priority for the sheriff. And as you're well aware, we are going through a little bit of a rough patch right now. However, I do think, I can't make any promises by any means, but I do think that I am very optimistic just over the last 5 months, what I've seen, that really that's the direction we're going. We need a little bit of help right now getting there. We need a little bit of a push, which is why we're here today.
And I do believe that, and I believe in co-response, but I have to ask that question because we don't want to see the stop in services, and I'm very glad to hear that is a priority for the sheriff and sheriff. So thank you for sharing that, and that's all my questions. Thank you.
Rupa had her hand up and then we'll get to Mary.
Yeah, so I'll just say that I know previously ROAC had funded a similar co-response program, but the ROAC money went to deputies. So this version of it feels a lot better from my perspective as a ROAC member that we're funding actual clinicians. So you all have my support.
It looks very organized, specific, targeted toward what you need. It looks like you've got good reporting after the fact that'll be there. Looks pretty good to me.
It's my job, yeah. So that's why I said I'm relatively new to the sheriff's office, and so yeah, I'm big on data and other things. So.
I do have a question, just to make sure I'm clear. So are these two clinicians going to be members of, are they going to be employed by the sheriff's office or are they going to be employed by UC Health?
UC Health. We
So
will
there's-
contract through UC Health.
Okay, so they'll have the support through their clinicians, peer team, and they will not be on the payroll for the sheriff.
Correct.
Okay, thank you.
And that's the model in Fort Collins.
Correct.
That's double, because I couldn't take that out of it. I do raise, we bring this up with all grantees, that how much percent is of opioids? I, from a prevention standpoint, from a public health standpoint, know that there's a combination. We know meth and alcohol, right up there are the two leading causes of issues, and then comes marijuana. But 1.5% does concern me because on other grantees, we've had lots of conversation when they're at the 20 to 30%. So I just raised that to the council that this money is specific for opioid abatement prevention. However, we all know that's woven together when it comes to substance use and misuse. But the 1.5 does stand out to me from a data point that is a little, I'm glad it's only 1.5%, but we are using regional opioid abatement dollars specifically for a program that 98.5% of the time, it's not, according to their data, specific to opioids. So I just put that out on the table.
Can I respond to that?
Please.
Okay, yeah, I mean, like, I can work with what I have, right? And I think one of my takeaways is that we have imperfect data. It is very, like, those numbers are big stuff of self-reporting and the degree to which the person on hand is doing an intake. So moving forward, my goal is hopefully to, increase that amount of intakes drastically to, anyone we're engaging with is having that intake. But when we're trying to correspond that, I mean, just with the data that I have within our jail systems, like, I think it was just under 1,900 for withdrawals and so it's like, the data is what you have. I didn't want to hide anything and pretend like it's something different, but due to some other triangulations, our estimates is that it's much higher. But I understand, like we respond to the calls that are provided to us, and so the extent to which that's the population.
And I should have started off, I do appreciate you getting us all this data at the beginning, because this is how folks, we're asking everybody now. And so you were perfect, and it's very transparent, so I very much appreciated that. Jessica, did you have a comment? I saw something pop up. We'd love to hear from you if you have something to add.
Yeah, I was just looking at the longer, more detailed proposal and budget and saw that the co-responders are listed as direct personnel. So if it's a contract with UC Health, it probably needs to be listed separately and not direct personnel
Okay.
to avoid any confusion. Yep.
Yes, you're good at that, Jessica. Thank you for that. Any other comments, questions? Yes.
I just want to respond to her because I know she wasn't here when we started this, because it was branded, was expanding it, but Larimer County and Larimer County Behavioral Health paid for the clinicians. We made sure that was complemented so that it was a full embedded team. And we had to, there was no money to increase the deputies at that time. And so it was also the deputies along with the clinicians and having the training. And so that's how it was. It was to make sure those deputies had the special training, and I'm glad that training's in there, but I want to make sure folks know that Larimer County Behavioral Health Services, we have been paying until now, until just recently, we paid for those other clinicians. I wanted to bring that up, so thank you.
Thank you for that. Good to get the historical perspectives. Anybody online with questions? The last question, just to make sure they are riding along with the law enforcement. So they're embedded, they're not calling them and then they come out.
Correct, we're not secondary response. No,
Okay.
we literally would copy. There's no need to reinvent the wheel when Fort Collins is being very successful what they're doing. We
Good.
jump on board and do that.
Mr. Chair, I'll make the motion to approve the proposal in front of us for the 200 and sorry, I didn't need to look at it, $333 with the amendment to the proposal that it's not direct services, but contracted through EC Health.
There's a motion. Is there a second?
I'll second.
Second.
We have a motion, a couple seconds. Any further conversation? Hearing none. Does anybody oppose the proposal? Hearing none, it passes unanimously. Thank you. Good work. Thank you for what you do for our community. Okay, we got through that, folks. With that, I will briefly process, I'm sorry those that are online, but we've got our updated spreadsheet here. So with everything so far, minus the new information with Harvest Farm and the money with the letter, we are in the positive now, $131,504. So don't need to just, as we're going down the list, that's where we're at for year 4 funding. And I'm ready to move to year 3 reports.
Real quick, Mr. Chair. I would like to just have a suggestion for us to ponder. We really have been rocked with this report, and even though I'm a big fan of Harvest Funds, I mean, I'm still grieving and coming over my stunned shock. I really want us to before we kind of think, oh, we have this money to spend, let's spend it today. I think we should be really reflective and think about this going forward and maybe look at maybe changing some of the contracts to add that administrative costs and some of those other things. And I just want to maybe have us all be really reflective before we kind of, because we were in a deficit, now we have this, but I'm asking, because I feel like I need to be more, I'm a little bit, I have trepidation about the conditions, and I want to be thoughtful as we move forward. So I just wanted to state that. I hope the rest of the council would maybe join me in just thinking about that. So anyway, thank you.
Thank you. All right. Year 3, we're going to get our 6-month report from EBIX. And while EBIX is coming on, just a reminder to board members and new members, we only execute 6 months of the funding. So they come in and give the report. From that report, there's a decision made whether to fund the remaining 6 months or not. So we'll turn it over to you.
Good afternoon. My name is Ruth Miller, and I'm the Executive Director of the EBIX Family Resource Center in Estes Park. I'm delighted to be here to share with you our 6 months report. We are very excited because our goal was to recruit 2 community members from the Latino community to send them into training and have them certified as a peer support specialist. We were able to recruit 3. So we are very happy. These are trusted, well-known community members, and they are definitely building that trust with our families and the people that are joining the group. We developed English and Spanish support groups. We also established the referral partnerships. We created the attendance and the referral tracking system. This first 6 months was really focused on developing the whole structure, building a strong partnership, and we were able to accomplish that. Our goal to serve 30 individuals is still on track, and our enrollment on participants has begun. We have 16 individuals that are participating in the program. In regard, one more, the successes. So like I said, one of the success is recruiting more participants, more community members to be a part of this effort. The challenges, as we all are most likely going, it was on our agency funding. So our goal to launch this program was delayed a little bit because we had to cut some of our staff member, and that little transition really delayed a little bit of our milestones, but we were able to launch this month. And we are excited. Peer support groups are happening, and then especially in the Latino community, the World Cup is something that is very, very exciting. So our 3 peer support specialists are designing program besides this small support groups, and they are designing activities in Estes Park, outdoor activities like soccer, that it's kind of like theme of the World Cup. So we are trying to incorporate a lot of wellness into this program as well. We are not anticipating any shortfall now we launched it is running, so we are very excited. Our goal remains on track. And just as approved, our budget, our grant amount was $28,792. We don't have any significant budget changes. We are anticipating spending the full grant. And administrative were asking me about, are we anticipating to apply again? And yes, we are. This is an extension to our mental health and behavioral health program with 2 therapists that we contract with. So this peer support specialist is an extension to the overall program. So we are definitely planning on applying for 2026, 2027. And we were thinking about proposing a little bit over 27,000. So that's my report. And the category is the same. We are going to apply under the same category. And we are grateful for this support for our community up in Estes Park. And I'm happy to answer any questions.
Yeah.
Yeah, and good to see you. Couple of questions.
Yes.
I really think it's important to emphasize the peer support because it's the cultural sensitivities of being able to talk to folks who understand those sensitivities. So I think that's really important. I wanted to highlight that. It's busy season right now. So can you share with me, that's my first question. How or when do you think would these happen? And my second question is, you're reporting people in treatment and recovery. Are you tracking somehow that this is tied to opiate use, and how does that look like? And is it self-reporting, and what does that look like? So to the 2 questions.
Great question. Definitely, Estes Park is, we are entering into our busiest season. And oftentimes our workforce, because these are people that are working in the community, Latino community, the slowest season or days or the rest days are usually Mondays and Tuesdays. So we are targeting those days in the evening. And then there are other days that the peer support specialists are designating as the outreach, the playing soccer outside, bringing families, integrating all the other nationalities into the outreach. In regards to the intake, our participants are going through an intake process through our 2 therapists that we have contacted with, and they do the referral. It's an internal referral. So they do the intake, they go through their questions in regards to reporting, all the things that goes in the intake, and then these therapists refer them to the 3 peer support specialists so they can continue and follow up.
We know a lot of sometimes for any culture, any family, substance abuse can be generational. So is there anything built in for helping maybe helping younger family members avoid, patterns, and is that part of this peer?
Absolutely. There is a part of the super group, the education and the support. Yeah, it's a part of the program.
Thank you for answering my questions and driving. I was up there presenting up at the total workforce thing this morning, so I know how long the drive was today. Thank you for coming down here today. Appreciate it.
Thank you.
Yes, ma'am.
Knowing your work quite well, in essence, particularly on the child care side and that support, I'm very comfortable with your request. I know that the funds will be handled well, that the work will be targeted toward what you say. and that you will continue to help the community. So I have very good faith in that. I drove down today and didn't have a single car in front of me.
You're so lucky.
Never happens.
You are so lucky. Thank you. And I echo his comments. So I'll make that motion. There's no other further. I'll make a motion to approve the 6-month report and to disperse the this is 6 months, right?
Yep,
So,
yep,
and
yep.
disperse the second 6-month funds to index.
We got a motion. Is there a second?
Second.
Who was that seconded that, just to make sure?
Zeke from Loveland.
Thank you, Zeke from Loveland. Appreciate that. Got a motion and second. Any further conversation? I just want to add, you're doing amazing work. It's only asking for $28,000 to change, so hats off to you. Great work and beautiful as this park. With that, anybody opposed? Passes unanimously. Thank you for your
Appreciate it. Thank you so
wonderful work.
much.
Okay, moving right along. We got La Familia 6-month report. Gloria's coming on up.
I'm coming.
All right.
Well, hello, everyone. Thank you for having me here today. I'm going to provide you with our progress report. 6 months have happened already, and so we have 3 main objectives. The first one being the training of at least 10 peer support specialists. And we ended up training a cohort of 16, which is really good. And those include 3 from EVIX. So I just want to clarify that we just partnered and we did the training. It was absolutely wonderful. 40 hours of training with the facilitated by the Yarrow Collective. Next slide, please. So we have been collecting a lot of data through the work that we're doing. And this is just a graphic that shows how the people that have been engaged in our social connection events have increased their knowledge, for example, how to safely store and dispose sharps and medicine. It went from 71% to 78% after. And I brought a sample of what we've been doing with the community when we have these social connections. Thanks to the health district, we were able to bring information in English and Spanish on how to safely store, dispose medication. So, and also sharp objects. So these have been very successful. And I was talking to Ruth that maybe we can do something together so they can get some of these, or tell them how to do it. You can go to the next one. So once again, this is related to opioid and substance use disorder. The district has a video in Spanish, and we had families watching that video through the social connections once again. And we applied a pre and post survey, and the knowledge you can see before 67% went to 81%. So I think the intervention that we are delivering has been effective so far. Then you can go to the next one. So one of our commitments was to conduct a tour of the Longview campus right here. We had a cohort of 25. It was a mix between staff members and residents and mainly the peers that came when Brian was still the director. These are the findings. This is when we conducted the focus group and we did the interviews. This is the information that we gathered, and I'm not gonna read everything. This is just to show how important that focus group was and the findings. And what I'm interpreting from this is that there is a big need for awareness. Families are giving us ideas like, can you please create a video in Spanish? Because some families, they don't know that this facility exists. And what happens is that they go to All Remedies or something, or they call their uncle somewhere else to say, hey, what do I do with my child, my teenager? So I feel that this is really valuable, and there's a lot of opportunity to continue the work that we started. So can you go to the next one? So our last objective includes the identification of 5 top barriers. I think we have more than that. We ended up with 8 barriers. And this is thanks to the conversations that our evaluator, our external evaluator had with some of the providers. And I feel that we need to have more collaboration, even when we think of our center. Sometimes we assume that everybody knows what we do. And I feel that there's a lot of turnover as well in other organizations. And I think through this work, we can have better conversation and really support each other. Making sure that there's language access, that's something that came out of the interviews. So making sure that the families know where to go, that they feel welcome wherever they go for behavioral health. And that there's a lot of awareness, like somebody mentioned, probably during the events, have somebody from Longview talk about what they do here and why is it important to understand like what services are available in the community. So we're basically, this is a month old already, and we have spent everything up to date. So yeah, we're doing good on that. And the last, this is the question that I was asked to include. Yes, we would like to apply again for the next cycle. It's not the same amount, it's about $10,000 less because we don't need to include training, but we would like to continue working and making sure that all the recommendations that we discover from the residents that they could be implemented, across Larimer County. We wouldn't be efficient just providing the data and then not doing anything with it, but really we want to increase and strengthen that collaboration with other partners. So yeah, that's what I have.
Questions? Yes.
Oh, I have a question, sorry. Hi, Gloria, good to see you. I'm so glad to see both of you here today.
She left.
Oh, she left, darn it. You'll see Petra for me. When you say you did a tour log, you're probably just in the inside here and things. And I think that's great to show that. But you keep talking about substance abuse. I mean, we ask this of everyone, so I just feel like we have to really kind of emphasize this is funding that's supposed to be used for opiate, and we know we have schools are doing that and showing that data. So are you able to track? But it's just not substance abuse. We know you know all the things. It could be polysubstance, but are you able to track self-reporting or how much opioid use is in your community? Are those folks you interviewed, and are you tracking that? And also how they're able to maybe again that generational, trying to prevent younger members of the family from going down that path, or teaching them the dangers of opiate use, but even I still think I heard the other day there's still pill sharing things. So yes. I'm wondering about that. How are you tracking that so we can show also this direct tie? I mean, there is the prevention. I think is really important and great job, but also how are we tying this to show the opiate use?
Absolutely. That's a great question because we do have a case management program, a bilingual case management. We are able to track all that information. As you said before, sometimes the family comes to us and we don't say anything because there's a lot of stigma and fear. We're definitely educating through this program and just naming things how they are. On the other hand, I feel that the second phase of our work is understanding and connecting with the sheriff's office and the police department because of how things are reported out in the community. We had an overdose at Harmony Village. And it was very difficult. People knew it was an overdose, but we didn't get to see how it was reported. And they implemented, they have a booth with the Narcan and, things for the community to just go and grab it. I feel that we need to focus on how we can better address that. Maybe it's a specific mobile home park or the ones that we work with them mobile home communities, and maybe through the peers, we can start sending out more information and be very specific about that. Recently, we had a case, and that was really shocking, a 13-year-old that started using. We don't know exactly what, because the mom was in tears. The boy got suspended from school. he was hanging out with the wrong people, things like that. They seem to be doing better now. But for us, it was a little bit of a challenge to know how to connect this family that was very much isolated from the school. The child was suspended and there was a lot of stigma. So we're still working with the mom and the boy, a 13-year-old. Luckily, he didn't have to come here because we're providing that support, that early intervention and detection and the education. She recently lost her job, so we're really actively working with that family. So that's a good example of how we are.
Thank you for sharing those stories. I think they're important, but we also have to have the data, so I think that's
Yes.
important. So do you think having the peer-to-peer help will make folks feel less stigma and maybe more open and able to report?
Yes.
Because it's not really like, what are you taking? It's like we have to have that data and also know how we need to target things. And so I'm wondering if you feel that peer-to-peer and having some of this in place now that you have done and started to implement, do you think
Yes.
that might help folks feel more comfortable?
I think it will definitely help because just one of the examples, speaking to one of the providers, it was Summit Stone saying, we have an intake procedure that the packet has 30 pages. I feel that if we bring the peers and we start, connecting the peers to understand what's in that packet, so that way they can share that information because they're always on the WhatsApp, hey, does anybody know where I can go for this, where I can get that? And I feel that having that training, we're also working with the school district. We haven't set anything up yet, but training on how to eligibility around Medicaid and SNAP, because those changes are coming soon. I understand October or next year, we're gonna see people, we don't want them to lose benefits because somehow we still have a lack of behavioral health providers that can speak Spanish or understand the culture. So we want to avoid, many people falling off the cracks and missing the deadline. So I feel that we have a lot of prevention to do, but really continue the education on opioids.
Thank you. And I think this is important because we're hearing directly from the community and understanding maybe the gaps that we don't know, and maybe what we need to understand. So I appreciate you answering my questions. And thank you for your work.
Yeah.
And I'm sorry for the loss in the community, especially someone so young.
Yes, certainly from a volume of work and patient standpoint, you guys are way bigger than like Ruth and Eve side and everything. And so the relative scope of the funding seems in line with that. In my respect, I don't have any other questions.
Yeah.
Anything else? Motion to accept 6 months.
I'll move to accept the 6 month for La Familia at 152.68.
I'll second.
We have a motion, a second. Any further conversation? I just appreciate all the collaboration. I love working with the Yarrow Collective. I just see that with all of our grantees, much collaboration, working together. And I think that's the synergy that really gets things done. So I'm glad that that's how it's being implemented.
That's a great point.
All right, anybody oppose that motion? Hearing none, it passes unanimously. Great work.
Thank you very much.
That's wonderful work.
Just an example.
All right. Moving on to now some final reports. The only action here is just to accept the final report. There's no funding tied to that because they've received their second half. But let's have the Northern Colorado Health Network come on up to give their final report. Plus, they do have a request for unspent money.
Yes. We've got a party.
All right.
Y'all, thanks for having us. Thanks for funding us.
Yeah.
You want to kick us off?
I am Rebecca. I'm the new prevention service manager. I believe I was here for our 6-month report, and I was brand spanking new, so happy to share some information this go around. Our overdose reversal impact, we have 236 reported lives saved within our community. And again, those are just reported, not including those that are not reported to us. We have completed 1,752 tests for our HIV and STI testing and been able to link 22 of those individuals to appropriate aftercare. A Suboxone clinic, we have made 160 referrals to that Suboxone clinic in-house. And our Hep C clinic as well is also embedded with Suboxone. We have treated 2 individuals from Larimer County Corrections, as well as currently treating about a dozen more. So good work there, as well as some behavioral health support. So we have provided 201 referrals to our in-house Connect team, as well as community partnerships, what we were speaking on earlier, 394 referrals to different agencies, including NCHA, Homeward Alliance, Sunstone Health Partners, and a couple of other folks in the community. These are just some demographics as far as the participants that we've been serving through our program. So 464 have reported as living in unstable housing. 420 of them are receiving Medicaid. And then we do have 67 that reported not having insurance, 179 identified from the LGBTQ plus community, and 233 reported syringe use at time of intake. So we also have a quote here as far as the supplies we use and how it can be used. We had an individual come in who was asking for syringes for their HRT. So it was great that we were able to get them those supplies, as well as linkage to care to our Connect folks. Rolling down here, this is just a couple more numbers. All of our deliverables we definitely met and superseded. So 6,000 total, 6,779 total visits. Let's see, 1,331 unique participants, 435 HIV tests. All of our testing has been broken down here in this box as far as how many of each test. Supplies distributed, 167,973. Syringes have been distributed and 130,764 have been returned. So our return rate has been at 77.85%. Currently, we are sitting at 100% for this go around, going into this funding year. 2,765 safe snorting kits were distributed and 17,838 safer smoking kits. Some exciting numbers on the bottom here. We have been able to do 450 xylazine test strip trainings, and that is over 2,000 of those strips going out into the community. 455 trainings for fentanyl testing strips, with over 5,000 of those going into the community. And then we have we've completed 451 trainings on naloxone and Narcan, with 4,400 of those doses going into the community as well.
Oh, this is me. Hi, I'm Rebecca M, and I am our Associate Director, Rebecca L, Rebecca M. I'm our Associate Director of Behavioral Health in the North, and we struggled a little bit this year. So it took us a little bit longer to get the program developed, get the right people in the right seats. We finally hired someone for the clinician position, and then she had to go out on maternity leave, which happens. So I think that certainly explains our inability to meet some of our deliverables, the tier 2 through 4. It's exciting right now. She's back, baby's great. We are on track to exceed these numbers significantly and exceed our deliverables for this next grant year. And then the MAT referrals, we came to realize that the partnership between Family Medicine Center and the Syringe Access Program, Family Medicine Center does our Suboxone clinic, was so strong. People aren't coming to us for MAT referrals. They can go to Rebecca L and her staff. And so we got 5, which was cool. But what I really want to focus on is that we got 21 referrals to higher levels of care. So that includes detox, inpatient, outpatient, sober living, primary care, psychiatry, so things to really help people be the healthiest versions of themselves. And so looking forward to our next grant cycle, we're gonna like MAT referrals and higher level of care, because I think, prevention's really got MAT down already. Like people trust them, people know them. And yeah, we're just here to help find the right, maybe rehab or detox or other levels of care for folks.
Wellness has gone well. We exceeded our goals around professional development. We've rolled out a CHN Center for Excellence, and I've been able to support our wellness initiatives through being the Director of Behavioral Health and Wellness, and I'm Danny again. We superseded and hit 51 total professional development and 17 leadership academy. This is something we've never done, and so it's working, and we're thrilled to see it work. We've grown our strengths as well and have a strengths consultant for Clifton Strengths, which has been a really exciting way to support our staff to be well in the work and be themselves in the work. Additionally, we have wellness assessments that we've partnered with Resilient Colorado, and they've done a fantastic job helping us to assess the staff and be able to meet their needs. And we've increased from 29.45 to 31.43, meaning we are really leading in leadership, autonomy, and creating meaningful work for those that provide the work. And we know if we keep healthy staff, we can have healthy participants, clients, and patients, and that's our goal at CHN. We continue to have the behavioral health copay support, so that's a new program that came with this funding. We provide $300 of copay support for our staff to go see their own clinician, and that is highly utilized and been a top benefit that staff talk about for the reason they retain at our agency. We also have 8 hours of wellness leave, and our staff use that to the max, I would say. And that means if they need a minute, they had a hard story around distributing Narcan or heard of an overdose, we can allow them to take a moment and get them back up from another staff member. We are providing group soup and individual supervision as well, and consultation is needed. So we do monthly for prevention. I provide that, as well as weekly for our behavioral health staff. We also do as needed incident report debriefing, which we use that robustly and consult with all the teams. It's going really well. It's an exciting new program.
Next slide, please. Okay, right off the bat, I'm gonna just name it. It's the wrong information. And so I'm so sorry. So please reference the numbers that are in your board packet. I'm so sorry that we did not get the presentation updated in time. So the numbers in the board packet are going to be reflective of our request for rollover. These are accurate expenditures, but not accurate for what our rollover would be. Due to unprecedented staffing issues in our accounting department, they've been down 2 staff members for 6 months. As well as some folks out on medical leave. They have been in a really challenging space, honestly, and we've been pretty transparent with that in our reports. So please use these cute little budgets that are in your packet. And then I'll pass it back to you.
Yeah, so in reference to the 4 budgets, as you all know, how we worked the first time around was complicated. It wasn't streamlined, and we appreciate the council's grace and support and guidance through the process of us learning how to request funding. But as you know, we requested from 4 buckets. 2 of those buckets are underspent. They're underspent by $96,337, due mainly to the development of the Connect program in behavioral health and the wellness program. And our learning curve, or mine transparently, has been around adding more time for program development, retention, and hire. And that was something we didn't budget in. As you know, it took us 6 months to 9 months to hire that clinician, who then went out on leave. So we do not foresee that as a future issue. We are asking for carryover funds to continue and honor that we had staff turnover, we have program development, and now we have the program up and running, and we have it developed, and we're meeting the goals. And we had family leaves. We've also created policies and internal infrastructure around our family leaves. That is historically something that was a huge learning curve for us this year, as that was new in the state of Colorado. So we believe that we can spend the money and the rollover funds with fidelity and integrity as we are lean into the next cycle, meaning we didn't collect much wellness request or much request for Connect other than the staffing. We took out our interns, we took out a lot of those pieces that we could support if we had the carryover funds. And we, again, would want to be intentional. The wellness funds, we had a big learning curve because we did more of that internally than having external contractors. We'd like to work with those external contractors if we'd be able to. That's it. Thank you.
Questions? Ms. Custer?
Thank you. I've a couple of questions. First, just for what you just said, can you clarify what you want to use the roll funds again? I'm kind of, I think I lost it.
I didn't say very clearly.
Yeah, and I know why you have it, but it's not clear what you're trying to use them for.
We would keep them in their line items. We're not looking to change anything from them. We would just carry them over. So for example, our wellness, we took that down to almost nothing, so we would carry that over there. We took our interns off because we trimmed as we were all being really fiscally minded this next cycle. So we could have them going. What else? We'd have the therapist going.
Yeah, some of the program development stuff, like getting basic needs supplies for incentives. Now that we've got that program staffed, we actually can purchase the incentives and provide them to people that need them.
Trim that back.
Yeah. That's primarily, I think, the bulk is in the Connect program.
And the wellness, so the consultants as well.
And we have 1,400 to roll over from the harm reduction aspect of it.
Not much.
And I would love to put that into supplies since we significantly reduced that by $12,000 this last year.
So if you are granted extension, what's the time period? Because is it the time period to the end of the next 6 months, or, I mean, what is, I don't know if I saw that you're.
We didn't say a timeline to it.
So I would assume that we have to be in this, we'd have to be very clear that it has to be in this grant cycle.
That makes sense.
So through March of 2027.
Yeah.
That makes sense.
I think we can do that for sure.
That's a great question.
Thank you for that.
And then my next question is on what we've been asking everyone, and I go back to the beginning of your data. There's a lot of probably polysubstance use and other things, but this is about opioid abatement and opioid use disorder and abating and doing that. So, so the question is, because I see a lot of STDs and HIV, but we're really supposed to be using this for opioid abatement because we're getting audited and by the national and state. So I'm not saying it's important work. It's all important work. I wish we had money for everything, but this is what this is for. Can you share with me a little bit how you're able to show this, that most of this is really addressing the opiate use or recovery for that?
Can I chime in? So I can actually pull a report where we take on intake who is using what substance, what that looks like. Really, truly, the STI information, you're not funding that in this next grant year. I think we only had $4,000 of that in the previous grant year. That's really just to demonstrate that it's an effective tool for a public health model of communicable diseases. I think that as harm reduction continues to be under fire, like any chance that we can say like, look, people are accessing all sorts of services through this. That's kind of our approach with that. But we can absolutely provide you with that data if that's something that you would like. We also collect additional data on overdose reversals. So were police called? What did that look like? Do you still collect zip code?
Yes.
Yes. So what zip code was it? So if you want us to alter the data that we provide to you, we can, but we would still like to highlight that we are of benefit to the community.
I appreciate that, if I might, Mr. Chair. I think that's important, but again, when we're having this, we are, because it comes through the Colorado Attorney General, we need to show this. And yeah, the other benefits are great, but I think if we had that data, that would help really a lot. And then that was my next question about the overdose reversal, because it said life-saving naloxone and other reversal. So that would be really, because 236 lives is tremendous and really important, but would really be great to show how that's related to fentanyl or to the opiate. And I think that would also be great to have that data to show, because I think that is also significant. And then, yeah, it's great to have the other testing and see how we're impacting, but really this is about the opiate, how we're using that money to target to help with opiate use disorder prevention or, treatment. So I would like to ask Mr. Chair if we can have that maybe in the next report, have all that data from all of that to be shared. Thank you.
Consider it done. We got you.
Like for our 6-month report or sooner?
I can get you the data for the previous year.
There's no space on the agenda.
I mean, we're fine to be in the corner.
Yeah, if you want to send it to us for what you have
That'd be
now,
fine,
and we can look at it later, and then for the next one, that would be wonderful. Thank you.
Any other questions for this? fine party team.
As a mob.
Yeah.
I
Takes a village.
assume you're both Rebecca also.
Oh, yes, I am Rebecca X. No, I'm sorry, I'm Izzy. Pleasure to meet you. I'm Director of Prevention Services, sorry.
I'm Danny Willis.
I will say that harm reduction, such a preventative model, at least overdose, those things, from a public health standpoint, it is under fire. It is costing more. So we as a council are going to have to recognize harm reduction is what's been saving lives and getting that trajectory to come down. Then we start working with recovery and treatment and those good things. But I'm worried about harm reduction and the access to fentanyl strips and, reversals, whether it's Narcan, et cetera. So
Well, that's why I wanted to kind of maybe dig down so we can really, in case, they do ask us questions, like, can you give us more information on this from the state? And I think if we had some of that, that would help. Because 236 lives reported, I mean, that's tremendous. That's really tremendous, but it would really like, specifics, that would be great.
Yeah, those are all opioid overdoses. Those are not, we don't ask about stimulant, like overamping. That is just strictly opioids. Because we ask when we're distributing our Narcan if they've used their last hit.
Maybe kind of, if we can highlight that, would be great. For a lot of folks that maybe aren't as well expertise as you all, have trouble just pulling that out, so thank you.
So we do need, there is a request here for the unspent money. Is there a motion for that?
I will make that motion with the amendment that it applies to be spent and used in this grant within that grant cycle, when it was approved.
And I'll second. We have a motion and second on the unspent funding. Is there any further conversation? Hearing none, does anybody oppose the motion? Hearing none, that passes unanimously. Thank you, appreciate you. All right.
Thank you all.
Great work, I appreciate it. Moving on to the Northern Colorado Health Alliance. I always disclose that I serve on the Alliance's board of directors. If there is any approval, whether it's funding or grants or whatever, I excuse myself, but in this case, there isn't. It's just their final report. I was planning to stay unless anybody on the council would rather me leave. Okay. MJ, turn it over to you. You got 1 minute. No, I'm just joking.
That is not uncommon and that is not feedback in any way.
30 seconds.
Oh, hey, I got that.
I know you do.
I have proven the skill set. Well, thank you all for letting us come and present our annual report. I am pleased to give you the 40,000 foot view, which is on slide 2. And that we did it all. We did it really well. And we spent all of our money, but we achieved all our objectives. And so that's like high level summary at its finest. That's great. But our goal areas are really tied into these 3 buckets. And so we have a variety of work living in the scope with the council, and that has been incredible for us to be able to wrap support around our folks who are in the community and active use, our community at large, and the providers that support them every day. So goal 1 is really tied to connecting people to care. And so that care coordination and peer recovery support, we were able to support 413 unique individuals in Larimer County with the funds. To that end, the care plans are what we call internally the strategies that person wants to go and do with us. And so they are all directed by the individual, and we just help them figure out how to get there. A lot of our work is tied to medication-assisted treatment. That is the best practice gold standard around opioid use. And to that end, our staff are co-located all over the place. You heard NCHA or NCHN, it's confusing. They have a very similar acronym. Sorry for being back to back. That we are actually co-located with our colleagues over there. But also in our clinics throughout the region. We're administering MAT. We're in our community-based organizations, our shelters, structures in particular, our hospitals, our jails. Our staff are really in the spaces we can connect with people the best because they're already headed there. They also come right on in the door down the level. So that's great. Ultimately, we saw an incredible amount of outcomes this grant cycle. Ultimately, across all substances, we saw decreases from intake to 6 months. But to really paint a picture of who our staff are serving every day, 50% of the folks moving through our structures are unable to afford their food. 64% cannot afford their health insurance. 64% clothing not getting through. Phone 60%, housing 66%, childcare 64%, transportation 67%, utilities 69%, and over 74% of our folks are people with kiddos in their care. And so it really paints a picture of the folks that are moving through our structures and just how hard this world is right now for the people we serve. But ultimately, through all of that, we've seen incredible success with our members. And so to that end, people receiving services with our staff, 92% said that our staff had a positive impact on their treatment and recovery journey. Wow, that's staggering. And I know we always talk about zip codes, so I wanna make sure I address that. 91.4% of our folks engaged were in Larimer zip codes. I did look, because we actually serve 12 counties. I did look across our different councils to see how this compared and how this lined up. And actually in our wealth abatement structure.
I had to stop you because we've been talking about how we're gonna look at other counties and look how they're doing it, so thank you.
I hope I don't make a mess for everybody, right? But we saw in the Northeast, 10.7% were outside of those counties as well, and 8% of those members were actually from Larimer. So if we're thinking about it, people are moving, right? People are moving around. The Weld County data looks very similar. I just want y'all to know that we're making up the difference somewhere else.
It's funny, but it's not funny, but it's funny because we and I'm not meaning to take your time, but we were wondering about, regionally,
how does this all shake out?
It shake out, and it's kind of how we thought, so so that's the only reason we're laughing. It's not laughing because it's good to know that our people are getting help with our neighbors. That's the point.
What's incredible about the same percentages on our hospitals, because we share hospital system with Weld and Larimer, who's in our hospitals.
Yeah,
it's very similar. Bob Pember, 8 to 10%.
Yes, around 8 to 10 across the board. And so I was intrigued by that as well. And so I was like, I'm gonna do a little dive here. We should do a cross-county study.
No, I'm serious.
Oh, I am too.
COAG, and let's see if they'll fund it. I mean, seriously.
That would be really, really
Can we partner
fascinating.
on that? I think that would be helpful.
I think we should bring it to the state COAG, the
That's what I
data,
just said.
and
Straight to
then
COAG.
see what they want to fiddle around with.
Sorry, I'm taking your time. You have 10 seconds.
Oh, gosh. Okay, so this is a cool number. And that is the number of doses of naloxone that our team was able to distribute in Larimer County alone. And so there are 2 doses per kit. So 11,057 kits and 22,000 doses. We also distributed 13,639 testing strips, which is awesome. Similarly, got a whole lot of printed education materials out there, over 17,000, nearly 18,000 there. And we also have harm reduction vending machines located throughout our shelter structures. We're moving this one as we speak. Yeah, it's sitting for one more week, and it's headed to the Salvation Army in Loveland.
Okay.
Because, well, the Loveland shelter is closed, and so we still want to make sure it's present in that community. And so that has naloxone testing strip kits, hygiene kits, and menstruation kits to communities structures. We also hosted 3 overdose awareness day events. Loveland, Fort Collins, and Estes. Estes was the busiest I've ever seen. It was so cool. So cool. And we had it right in Bond Park. We had Jason Wentz playing music. People were dancing. It was incredible. But we're able to provide some education, do some recovery stories and journeys during that time, get people connected to resources and connected to community and support at large. Since I have 0.1 seconds left, next slide. Provider education, we did peer recovery coach training through the funds as well. Able to train additional 30 people through their first 48 of 60 hours. We do the first 48, that's pretty common, in that the last 12 are online. So that's great. Really bolstering our peer recovery workforce in that way. And the Rethinking Addiction Conference was wildly successful this last go. We partnered with the Attorney General's office this last year. Over 600 attended. We had breakout rooms galore, and over 50 speakers. And so there are more detailed reports of each of these buckets in your packet, starting on page 95. But those are the big highlights. And I will say we're in the midst of planning our Overdose Awareness Day events again for this coming year, looking at the second weekend in August, and I'll make sure the council has that information. And then for the Rethinking Addiction Conference, looking at October 30th, which is not on a Tuesday.
Thank you. Bring it out.
So what questions can I answer for y'all?
Yes, Commissioner.
First, it's my understanding, I just learned this, maybe I don't know when is it, is the national conference coming next month to Colorado?
NADAC?
Yeah,
Yes, yes.
and who was all invited? I don't think we knew that as a council.
The national conference? The National Abatement Conference.
That's hosted by Stedman.
Yes,
Yeah.
Stedman Group is hosting that.
And that's,
I think it's in Denver.
yeah, I wonder how I missed that, so. Are you guys presenting, or are you gonna be talking, or?
Unfortunately, our key leadership staff who would present at that space are not available during that conference, but I know quite a few folks who are attending. Yeah.
If I might, one other big question. So we'll look at maybe the joint state. Since you're covering so many areas and you have to keep all this data separate, and also the peer support is you're training, do you have numbers for here? And I'm just curious, are they ever shifted around to help where the need is? And because I can see that maybe some areas have more or less, and how would that work?
Yeah, so from a data and tracking standpoint, we actually track by grant. And so we're able to delineate what efforts are going into this specific funding bucket, so we can better report to y'all. Similarly, we have our staff assigned by grant, and so are able to then delineate that way. The only time we would have a staff member maybe doing this across Lambert and Weld is if we're leveraging a braid of those funds. And so for these funds, we do not have that in process.
And just always thought if there was a need, there might be some mechanism to just kind of shift once in a while if you needed to cover something, so, okay. More questions, but I know we're out of time, so I'll save it for another day. Thanks.
You have my email as well. Here.
I'll make the move.
I'll move to adjourn.
Well, we have to make.
Oh, we have to
approve
do
the-
an
I was
action
gonna-
for it,
I was going
just
to,
to accept this
I
report.
was going to make a motion to accept the report.
Okay, I'll second.
There's a motion second. Any further conversation? Anybody opposed? Passes unanimously. Thank you, and Jane, for the alliance.
Let's talk about that, Brent.
We are over time. You have one more final report on the agenda. We could go 10 more minutes.
I'll make a motion to extend our time 10 minutes. You need to leave?
I'll hang.
Okay, I'll make a motion to, it's just 10 minutes.
Second on that.
I can get it done in 5.
Can you get it done in 5?
That's me.
5 on 5, 4 minutes, 4 minutes. 5. We're gonna go 5 minutes longer. Thank you for your patience. Sorry.
No
Appreciate
worries,
it.
no worries. Thanks for the time. So what I wanted to present today was the findings from the ROAC survey that we did to advance our work on the pathway to change and the evaluation plan that we proposed this year. Do you want to slip to, as you might remember, this is our pathway to change model. Oh, those little figures didn't come out. Anyway, the aim of this is to provide the foundation for the evaluation plan, which we propose to conduct, to provide to you this year. And what hinges on this process is the vision statement. And what we wanted to do was make sure that we had the input from the ROAC in this process in the most efficient way possible, knowing that your time is obviously very limited. So what we did was we sent out a survey. The survey was developed in collaboration with our advisory work group. So thanks to everybody who participated in that. We had the survey open from April 28th to May 13th, and we had a response rate of about half. So it was good. It also went out to some of the subject matter experts and the non-voting members as well. So I'll just run through you have the results in your packet as well. But just to recap, that we had 100%, so all the respondents, 6 of our folks who responded, said that they agreed that the vision of this ROAC is the same as the vision of the Colorado Opioid Abatement Council, and that is thriving communities with a focus on youth, disproportionately impacted populations, and families affected by opioid use disorder. We're just using that as kind of our North Star in this process. And then in sorry, I want to make sure I got this right. In 2022, which was before my involvement with ROAC, I believe that you all developed a logic model for your work. And then one of the things that the advisory council did, the advisory work group did in 2025 was to pull out some of the long-term outcomes from those logic models. And then we presented those in January 2025, and the ROAC agreed to confirm those. And so we wanted to just ensure through this survey process that these are still, in fact, these long-term outcomes that are articulated by the ROAC. And it's to save lives, increase access to substance use disorder, opioid use disorder treatment recovery, sustain ongoing treatment and recovery support, and prevent substance use disorder and opioid use disorder. So we also asked in our survey to help feed into this model, what are some of the system complexities and contextual factors that Region 2 could support, that could support or detract from these goals? And overwhelmingly, so funding. I'm not telling you anything you don't know. Lots of funding from other sources, insufficient workforce and workforce retention, and fragmented support systems. That's what we heard. I think that's not going to come as a surprise. And so what are the community needs in Region 2 are important to consider to achieve these goals? Again, in light of the funding restrictions, it's an opportunity to partner to pool resources, focusing on the key task of opioid abatement, and addressing distrust of systems that came out as well. And so here's one of the quotes. That's okay. I know we're out of time, so we can go forward. I know this is in the packet if you want to dive deeper. So what Region 2 strengths are important to build upon when considering how to implement the ROAC's work? Consistent participation of the ROAC members, that came through and that's evident. Efficient distributions of funds and strong organizational partnerships and collaboration. And so just to summarize our next steps, we actually out right now, so any of the grantees in the room, you may have seen our Pathway to Change survey. We have a survey out to all the grantees to ask for their input on when would be the best time to gather to walk through this process with the grantees. We think that's going to happen in late July based on the responses that we've received so far. And that we're going to continue to use the work group, advisory work group in May, well, we met last week, in June and July to further this work as well, to provide more context. So that's where we are. Was that 5 minutes?
Any questions?
I don't think it's any surprises, but it's nice to have it.
Yes, I agree.
Yeah, sometimes I feel like I'm telling you stuff you already know, but it confirms it. And again, it's just the opportunity to ensure that the ROAC is, make sure it has an efficient voice in this process. And we'll continue to provide you updates as it goes.
I make a motion to accept and approve this report, and well done. Thank you for your patience and work.
No worries. Thank you. Appreciate it.
With the comment that, yours is really right on target. It's at front and center, the opioid aspect of it. And that's good. That seems to cover all aspects. Good.
Got a motion and a second. Any further conversation? Hearing none. Does anybody oppose the report? Hearing none, that passes unanimously. Thank you for your work. Very valuable.
Thank you for your participation.
Mr.
Chairman, Chair adjourned.
Move to. Anybody oppose that motion? Hearing none. Oh, great work, everyone. You got through the agenda. Like always amazing. Good work, everyone.
Thanks, everybody.
Oh, yeah, it's during your week.
You've had a long day.
Yeah, it's,